Do you know who most victims with PTSD include? How about if you know anyone close to you who suffers with PTSD? Most victims diagnosed with PTSD are battle-scarred soldiers in military combat. But that is not the only cause of PTSD. PTSD can affect anyone that has experienced, witnessed, or someone who is just cleaning up after a traumatic event, for example, first responders. Today, I will be telling you what PTSD is and how medical marijuana helps prevent patients with PTSD, and I will also be telling you about a patient who suffers from PTSD and how marijuana helped them. First, I'm going to start by telling you what PTSD stands for. PTSD stands for Post-Traumatic Stress Disorder. According to the Mayo Foundation for Medical Education and Research, PTSD is defined as a mental condition that is triggered by a terrifying event that is either experienced or witnessed. Some of the symptoms PTSD include having severe anxiety, nightmares, and flashbacks. PTSD isn't in fact an anxiety disorder that can be caused by any traumatic event. Some of those, other than those involved in the military, include sexual assaults, terrorist incidents, natural disasters, and etc. So now that you understand what PTSD is, I'm going to tell you how marijuana helps patients who suffer from PTSD. Often when people who suffer from PTSD have trouble sleeping, major depression, anxiety, and fatigue. According to the Marijuana Medical Handbook, Practical Guide to Therapeutic Uses of Marijuana, physicians in California treat many PTSD patients with marijuana. PTSD patients treated in this clinic say that some of the many symptoms most commonly eased by the use of marijuana is sleep deficiency, fatigue, and physical pain. According to Dr. Mikura, the use of marijuana enhanced the quality of sleep through modulation of emotional reactivity. It also eases flashbacks, emotional reactions, and nightmares. So now that I have told you how marijuana helps patients with PTSD, I'm going to tell you about a patient in real life who suffers from PTSD and his story on how marijuana helped him. I have recently interviewed a veteran who lives in Arizona that suffers from PTSD and uses marijuana. I asked him approximately how long he had been diagnosed with PTSD and what caused him to have PTSD. Also, what kind of medications he was prescribed before trying medical marijuana. What caused him to have PTSD, he says, is when he was in Korea. He was there for 18 months, and that alone was very traumatic and stressful. He also witnessed some soldiers die in an explosion. Before trying marijuana, he constantly had flashbacks and nightmares of it happening, over and over again. He has been diagnosed with PTSD for approximately 60 years and was prescribed antidepressants before trying marijuana. He often said that when he was on the antidepressants, it didn't help him whatsoever at all, and that when he did try marijuana, that it was the most useful and very helpful for him because it helps him to cope with it instead of just constantly having those flashbacks and dreams, which is what medical marijuana is for. In conclusion, the more people who understand what PTSD is and what medical marijuana does to it, to help it, then maybe the more people will understand the benefits it has for people with PTSD and the possible benefits on others that have other medical conditions, such as cancers and etc. And that concludes my speech. Thank you.